Car accidents can create severe injuries. Without rapid and skilled emergency care, it is likely that many people would not survive a crash. As a healthcare professional, you need some basic knowledge of emergency medical care to be able to help people if the need arises. The following presentation is designed to introduce you to some basic emergency information. First aid is care that people give to an injured person before medical professionals arrive on the scene. When providing first aid, first do what you can to prevent the death of an injured patient and then work to prevent the person's injuries from becoming worse. During an emergency, it is important to activate emergency medical services, EMS, as soon as possible. All facilities will have emergency procedures in place, but if you are unsure of what to do in an emergency situation, dial 911, call the local fire department or police, or simply connect with an operator to activate the EMS system. Within long-term nursing care, there are a variety of emergencies you may encounter. The most common are cardiac arrest, heart attack, respiratory arrest, when a person stops breathing, hemorrhage, rapid blood loss, falls, shock, stroke, seizures, and burns. When in a life-threatening emergency situation, the speed and quality of care is critical and can often mean the difference between life and death. One of the most dangerous emergency situations is cardiac arrest. When a person's heart stops beating, first responders must provide cardiopulmonary resuscitation for the victim. This is an emergency procedure that simulates breathing and a beating heart in an attempt to prevent the person's death. There are emergency situations where a person stops breathing. Possible scenarios include drowning, stroke, choking, drug overdose, electric shock, smoke inhalation, coma. When a person stops breathing but the heart is still beating, rescue breathing should be started. This can help the person to begin to breathe. If rescue breathing isn't provided quickly, the person's heart will stop beating. To provide rescue breathing, you must open the person's airway by filling the chin and tilting the head back. Pinch the person's nose closed in order to prevent air from escaping. Take a normal breath. Place your mouth over the person's mouth, creating a seal with your lips. Breathe into the person's mouth every 5 to 6 seconds for adults, and ensure that the person's chest rises and falls with each breath. That is how you know that air is getting into the lungs. If the chest does not rise and fall, reposition the head and try again. Check the person's pulse at the carotid artery in the neck every 2 minutes to ensure that the person still has a pulse. If there is no pulse, you must begin CPR. In a healthcare setting, you will have access to a variety of tools and barriers to aid rescue breathing. Use these tools whenever possible, as they prevent contact with the person's mouth and blood. Common barriers include face shield. A face shield is a barrier that prevents bodily fluids, saliva and blood from mixing during rescue breathing. Mask. A mask provides protection for the healthcare worker and the patient. The healthcare worker provides rescue breathing through an attachment in the mask. Bag valve mask. A bag valve mask is a handheld bag attached to a mask. The rescuer simply squeezes the bag to provide breaths for the patient. The bag can also be connected to an oxygen source. Mouth-to-nose breathing. When the patient's mouth is not suitable for rescue breathing because of injuries to the mouth, jaw, or there is severe bleeding, to provide mouth-to-nose breathing, tilt the head back, close the patient's mouth, provide a strong seal on the patient's nose with your lips, and breathe into the patient's nose. Once you give a breath, remove your mouth from the person's nose to allow the air to escape the lungs. Mouth-to-stoma breathing. There are also times where a patient has a stoma, which is a hole for breathing in the neck. In this case, the rescuer must provide rescue breathing through the person's stoma. To do this, keep the patient's mouth closed. Do not tilt the head back. Seal your mouth around the stoma. Blow air into the stoma. Watch for the chest to rise and fall. If the chest does not rise, you may need to pinch the nose shut. Emergency situations are scary. It is important to stay calm and think before you act. Do not do more than you are able. Stay within the bounds of your ability to care for someone. Be aware of life-threatening injuries. Check for a pulse, breathing, and bleeding. Keep the person lying down and do not move the person unless you and the person are in immediate physical danger. Activate the EMS system or have someone near you call 911 if you are busy providing care. Do what you can to reassure the person and make her comfortable. Do not give the person food or fluids. Provide what care you can until help arrives.